talking about the myths and misconception about sickle cell disease. So, sickle cell disease is a disease condition affecting the red blood cell, making them to assume a sickled or a crescent shape or a C shape. The myths and the misconception. 1. Sickle cell disorder only affects black people. No, it doesn't only affect black people. It is common amongst black people, but it is also found amongst the Mediterranean. It is also found in the Mediterranean region, in the Middle East also. I think amongst Indian as well. Okay. 2. Sickle cell disorder is contagious. No, it is not contagious. Okay. You only inherit the disease condition from your parents. Having a sickle cell disorder doesn't mean you can just transmit it to anyone just like that. 3. Sickle cell patients have a short life expectancy. Well, with more advancement in the medical field, with more research going on about sickle cell disease, gene therapy, and all, people living with sickle cell disease are now able to live up to their 40s and 50s and so on. 4. Sickle cell disorder only causes pain. I don't understand. Like, pain is like the hallmark of sickle cell disease. So there are other conditions that sickle cell disease can lead to. There are other medical conditions that sickle cell disorder can lead to, like jaundice, like acute chest syndrome, pulmonary hypertension, ulcers, anemia, and so on. 4. Sickle cell disorder only causes 5. Sickle cell carriers, like sickle cell traits, have the disease. Okay, they don't have the disease, they are just carrier. Let me explain. Like people having the genotype of AS now, that doesn't mean they also have the disease. No, they are just carrier. They have the ability to transmit the disease to their offspring if they get married with someone of the same genotype. You get, but they don't have the disease. They are just carrier. 6. There is no treatment for sickle cell disorder. Okay, there is no known cure for sickle cell disorder, but there is a particular cure that is particularly meant for some people, okay, from age 16 below. So they undergo bone marrow transplant. Okay, now undergoing bone marrow transplant will prevent them from having pain or other complications of sickle cell disease, but it does not change their genetic composition. You understand? Okay, so that's about that. And then there's other treatments like blood transfusion. There's other treatments like pain management, hydroxyurea, and all. So 7. Sickle cell disorder patients should avoid exercise. No, you shouldn't avoid exercise. Like, we want to get that blood moving. We want to be moving around for that blood to keep flowing. We want to avoid increased blood viscosity, but avoid overexertion. Don't do overexertion. No, like little to like some small exercises, moving around, doing some activities. We have to get that blood moving. So you shouldn't avoid exercise. You should do exercise. Don't live a sedentary lifestyle. No. You shouldn't. So you can do exercise, but in a minimal level, not too much, because when it is too much, it is leading to something else like that. 8. People with sickle cell disorder cannot have children. Of course, you can have children, but you have to undergo genetic counseling before you can have children, because having a sickle cell disorder, if you go and get married to someone like AS now or SC or SS now, you are going to pass that disease condition to your offspring. So you have to undergo genetic counseling before you can have kids, or before you get married to have kids, so you can have kids as many as you want. 9. Sickle cell disorder is the same for everyone. It is not the same for everyone at all. Me now, I do have bone pain crisis. That's me. So for someone else, it is jaundice. For someone else, it is anemia. For someone else, it is leg ulcer. I know someone with sickle cell disease that is having leg ulcer for the past 4 to 5 years, having leg ulcer, and the person doesn't even used to have any bone pain crisis. So it differs. Okay, some priapism and all. Okay. 10. Sickle cell disorder patients should avoid cold climates. Okay, extreme temperature, both hot and cold, can complicate sickle cell disorder, can lead to bone pain crisis, or can complicate sickle cell. So people living with sickle cell disease are expected to dress appropriately to the weather around them, and I think that is all. Okay.